Good morning, everyone. Today, we will be diving into the fascinating world of endocrinology, specifically focusing on the intricate role of hormones and electrolyte balance. Understanding the mechanisms by which our body maintains optimal electrolyte levels is crucial for medical practitioners, as imbalances can lead to serious health complications. In this lecture, we will explore various hormonal systems and their impact on electrolyte regulation. So let's begin our journey by examining the role of hormones and electrolyte balance. Electrolytes, such as sodium, potassium, calcium, and phosphate, play fundamental roles in maintaining cellular function and overall homeostasis. The exquisite control of electrolyte balance is achieved through the orchestration of hormone release, feedback mechanisms, and their interactions with various organ systems. One of the key hormonal systems involved in electrolyte balance is the Renal Angiotensinaldosterone system, RAAS. When there is a decrease in blood pressure or volume, specialized cells in the kidney release the enzyme renin. Renin acts on a precursor known as angiotensinogen, which is ultimately converted into angiotensin II. Angiotensin II stimulates the release of aldosterone from the adrenal glands. Aldosterone acts on the distal tubules of the kidney, promoting reabsorption of sodium and water and excretion of potassium and hydrogen ions. This process helps to maintain blood pressure and sodium balance within our body. The Renal Angiotensinaldosterone system, RAAS, is a complex cascade of events that occurs primarily in response to changes in blood pressure and sodium levels. It starts with the release of renin from juxtaglomerular cells in the kidney. Renin cleaves angiotensinogen, produced by the liver, into angiotensin I angiotensin-converting enzyme, ACE, which is present mainly in the lungs, then converts angiotensin I into angiotensin II. This potent vasoconstrictor stimulates the release of aldosterone, leading to increased sodium reabsorption and water retention, thereby elevating blood pressure. Antidiuretic hormone, ADH, also known as vasopressin, is synthesized in the hypothalamus and released from the posterior pituitary gland. ADH acts on the collecting ducts of the kidneys, promoting water reabsorption by increasing the permeability of the collecting ducts to water. This results in water conservation, leading to concentrated urine production and prevention of excessive water loss. The release of ADH is regulated by osmoreceptors in the hypothalamus, which sense changes in plasma osmolality. Parathyroid hormone, PTH, is secreted by the parathyroid glands, situated behind the thyroid gland. PTH plays a vital role in maintaining calcium homeostasis. When blood calcium levels decrease, PTH is released, stimulating osteoclast activity in bones, enhancing renal calcium reabsorption, and increasing activation of vitamin D, which enhances calcium absorption from the intestines. These actions result in increased blood calcium levels, restoring balance. Calcitonin, produced by parafollicular cells in the thyroid gland, plays a counter-regulatory role to PTH. When blood calcium levels rise, calcitonin is released, inhibiting osteoclast activity, which decreases bone resorption, and promotes the excretion of calcium by the kidneys. Together, PTH and calcitonin maintain calcium homeostasis, ensuring an adequate supply for vital physiological processes. Potassium is an essential electrolyte involved in numerous cellular functions, including the resting membrane potential, action potential generation, and intracellular pH regulation. Hormonal systems, such as aldosterone and insulin, closely regulate potassium balance. Aldosterone acts on the principal cells of the collecting ducts in the kidneys, stimulating potassium secretion into the urine. Insulin, on the other hand, drives potassium into cells, helping to maintain normal extracellular levels. We have already discussed the main role of the Renal Angiotensinaldosterone system, RAAS, in sodium balance. However, it also has a crucial role in water balance. By promoting sodium reabsorption, the RAAS indirectly influences water reabsorption, as water follows sodium. Therefore, the RAAS plays a pivotal role in maintaining overall sodium and water balance in the body. Atrial natriuretic hormone, ANH, synthesized in the atria of the heart, acts as a counter-regulatory hormone to the RAAS. ANH promotes natriuresis, the excretion of sodium and water through the kidneys. It inhibits the release of renin and aldosterone, causing vasodilation and reducing blood pressure. ANH is essential in fine-tuning sodium balance and preventing sodium overload. Thyroid hormones, including thyroxine, T4, and triiodothyronine, T3, have widespread effects on various physiological processes, including electrolyte balance. They influence the reabsorption of sodium and water in the kidneys, promoting water retention and increasing cardiac output. Thyroid hormones also enhance the effects of other hormones, such as aldosterone and ADH, in maintaining electrolyte and fluid balance. Insulin, primarily known for its role in glucose metabolism, also influences electrolyte distribution. It promotes cellular uptake of potassium, magnesium, and phosphate ions, leading to their intracellular shift. This action helps to maintain extracellular electrolyte concentrations within the normal range. Insulin deficiency, as seen in diabetes, can result in abnormal electrolyte levels. Glucocorticoids, produced by the adrenal cortex, have significant effects on sodium balance. They increase renal sodium reabsorption and enhance the action of aldosterone. Glucocorticoids directly stimulate the expression of sodium channels in the distal tubules of the kidneys, promoting sodium retention. Prolonged glucocorticoid excess can lead to sodium overload and hypertension. Estrogens, the primary female sex hormones, have diverse effects on electrolyte balance. During the menstrual cycle, estrogen levels fluctuate, affecting water and salt retention. Estrogens enhance the action of aldosterone, which increases sodium reabsorption, leading to fluid retention. Changes in estrogen levels can contribute to conditions like premenstrual syndrome and pregnancy-associated edema. In conclusion, understanding the intricate interplay between hormones and electrolyte balance is crucial for healthcare professionals. The hormonal systems discussed today, including the renin-angiotensin-aldosterone system, antidiuretic hormone, parathyroid hormone, calcitonin, and various others, work together to ensure the maintenance of optimal electrolyte levels. Imbalances in these hormonal pathways can have profound effects on our health. By gaining a comprehensive understanding of these processes, we can better diagnose, manage, and prevent electrolyte disorders, improving patient outcomes and overall well-being. Thank you for your attention, and I hope you found this lecture informative.